Have you ever brushed off a strange symptom thinking it was just a normal part of getting older? What if that subtle change in your body was actually a silent cry for help? A warning sign that something serious was brewing beneath the surface? As we age, our bodies become more vulnerable, and certain symptoms can indicate a life-threatening condition. The problem is, many of these signs are easy to overlook until it's too late. In this video, you're going to learn about 6 dangerous symptoms that doctors urge you to take seriously, especially if you're over 60. These aren't just minor annoyances. They are powerful warning signals that could mean your life is at risk. But here's the good news. Recognizing them early can make all the difference. Stay with us to the end, because the information you're about to hear could save your life or the life of someone you love. If you've ever experienced any of these symptoms, share your story in the comments below. And don't forget to subscribe to our channel and turn on notifications so you never miss a life-saving health tip. Let's get started. 1. Unexplained extreme fatigue. There's a clear difference between feeling tired after a long day and experiencing a level of exhaustion that seems to come out of nowhere. Imagine waking up after a full night's sleep only to find yourself too weak to get out of bed. Simple daily tasks like walking to the kitchen, getting dressed, or even holding a short conversation feel overwhelming. This isn't ordinary tiredness. It's a deeper, more persistent fatigue that lingers throughout the day and seems to have no clear cause. If you notice that your energy levels have dropped suddenly, or you no longer enjoy activities that once felt easy, it's a red flag you should not ignore. Medically, unexplained extreme fatigue can be an early sign of several life-threatening conditions. These include congestive heart failure, where the heart struggles to pump enough blood to meet the body's needs, chronic kidney disease, which causes a buildup of waste and toxins in the body, or even certain cancers, which consume the body's energy as they grow. Other possible causes include severe anemia, thyroid disorders, or advanced infections. In all of these cases, fatigue is not the problem itself. It's the symptom of something much more serious going on inside the body. One of the most common mistakes people make, especially older adults, is assuming that fatigue is just a normal part of aging. While it's true that energy may naturally decline with age, persistent and unexplained exhaustion is not normal. It's easy to dismiss the tiredness as a sign of just getting older, but doing so can allow serious conditions to worsen undetected. If left unaddressed, this kind of fatigue can indicate that vital organs are starting to fail. Delaying medical attention can lead to sudden health crises like heart attacks, kidney failure, or severe infections. The body may be operating in survival mode, conserving energy because it's struggling to function. If you experience this type of fatigue, don't ignore it. Start by taking note of when it began, how it affects your daily life, and whether it's getting worse. Then schedule an appointment with your doctor for a full evaluation, including blood tests and possibly heart or kidney function tests. The earlier you act, the better your chances of identifying the underlying cause and taking control of your health. 2. Sudden and severe chest pain or pressure. Imagine sitting quietly or doing something ordinary when out of nowhere you feel a crushing pressure in your chest. It may feel like a heavy weight pressing down on you, making it hard to breathe. The pain might spread to your left arm, neck, jaw, or even your back. This sensation may come on slowly or strike like a sudden blow. In either case, it's a frightening experience that should never be taken lightly. Sudden and severe chest pain is one of the clearest and most urgent signals your body can give that something is seriously wrong. Medically, this type of chest pain is often linked to conditions that are immediately life-threatening. The most common and dangerous is a heart attack, where blood flow to the heart is blocked, causing damage to heart muscle. Another potential cause is an aortic dissection, a tearing in the wall of the body's main artery, which can lead to fatal internal bleeding. Other possible causes include pulmonary embolism, angina, restricted blood flow to the heart, or pericarditis, inflammation around the heart. All of these conditions require immediate medical evaluation. Unfortunately, many people, especially seniors, often mistake this kind of pain for something less serious. They may assume it's indigestion, gas, or simply stress. They might lie down and hope it passes or take an antacid, thinking the discomfort will go away on its own. This delay in seeking help can be fatal, especially if the pain is related to a heart attack or aortic dissection. Waiting too long to act on chest pain can mean the difference between life and death. The longer the heart muscle is deprived of oxygen, the greater the damage. In the case of an aortic dissection, minutes count. Without emergency intervention, internal bleeding can rapidly lead to death. Even seemingly mild or brief chest discomfort can be a warning sign of an underlying problem. If you ever experience sudden, intense chest pain or pressure, do not wait. Do not try to tough it out or ignore the symptoms. Call emergency services immediately. Do not drive yourself to the hospital. Getting medical help as fast as possible gives doctors the best chance to diagnose and treat the issue before it becomes fatal. Taking action immediately can save your life. 3. Difficulty breathing or shortness of breath. Imagine sitting in your chair or lying in bed, not exerting yourself at all, and suddenly feeling like you cannot catch your breath. No matter how deeply you inhale, it feels like the air simply isn't enough. This frightening sensation can come on quickly or worsen over time. It may feel like tightness in your chest or a sense that you are suffocating. Shortness of breath that appears without a clear reason, especially while at rest, is a major warning sign that should never be ignored. Medically, unexplained difficulty breathing is often associated with critical conditions such as congestive heart failure, where the heart is unable to pump blood effectively, leading to fluid buildup in the lungs. Another cause could be a pulmonary embolism, which occurs when a blood clot travels to the lungs, blocking airflow and oxygen exchange. Other possibilities include chronic obstructive pulmonary disease, COPD, silent heart attacks, or even severe lung infections like pneumonia. Each of these conditions can rapidly become life-threatening without immediate attention. A common misunderstanding is that shortness of breath is just part of aging or being out of shape. Many older adults assume they are winded simply because they are getting older or less active. While mild breathlessness during intense activity can be normal, breathlessness at rest or during light activity is not. This assumption leads many to delay medical care, putting them at serious risk. If ignored, shortness of breath can quickly escalate into a medical emergency. In the case of a pulmonary embolism, death can occur in minutes if treatment is not provided. Congestive heart failure can worsen, leading to fluid accumulation in the lungs, reduced oxygen levels, and ultimately organ failure. Even less dramatic causes like pneumonia can be deadly in older adults if not treated promptly. If you or someone you love experiences sudden or unexplained shortness of breath, especially if it's accompanied by chest discomfort, dizziness, or fatigue, seek medical attention immediately. Sit down, stay calm, and call emergency services if the symptoms are severe or worsening. Getting help quickly can make a critical difference in identifying the cause and preventing a potentially fatal outcome. 4. Drastic and unexplained weight loss. Imagine stepping on the scale and realizing you have lost several pounds without changing your diet or activity level. Your clothes start to feel loose, your belt needs tightening, and people begin to comment that you look thinner, even though you haven't made any effort to lose weight. At first, this might seem like a welcome surprise, but when weight loss happens suddenly and without explanation, especially in older adults, it is often a sign of a serious underlying health issue. From a medical perspective, unexplained weight loss is a red flag. It can be an early indicator of several dangerous conditions, including cancers of the pancreas, lungs, or digestive tract. These types of cancer can cause the body to burn calories rapidly and lose muscle mass even when you are eating normally. Other causes may include poorly controlled diabetes, hyperthyroidism, chronic infections, or advanced heart failure. These conditions interfere with the body's ability to process nutrients, leading to significant and unintended weight loss. A common mistake is assuming that losing weight is simply a result of aging or a decrease in appetite. Many older adults may view weight loss as a normal part of getting older or even a positive outcome if they were slightly overweight. But when weight is lost without any lifestyle changes, it should not be ignored. It may be your body's way of alerting you to a more serious problem developing inside. If left unchecked, drastic weight loss can lead to severe weakness, muscle wasting, and a compromised immune system. This makes the body more vulnerable to infections and complications. Moreover, if the cause is cancer or another critical illness, delaying diagnosis can allow the disease to progress to a more advanced, less treatable stage. In older adults, even a small reduction in weight can have a significant impact on overall health and independence. If you notice that you or a loved one has lost more than 5% of body weight within a few weeks or months without trying, schedule a medical checkup as soon as possible. Request a full evaluation, including blood work and imaging if necessary. Early detection is key to treating potentially life-threatening conditions and maintaining your strength, energy, and quality of life. 5. Confusion, disorientation, or sudden personality changes. Imagine a loved one who has always been sharp and engaged suddenly becoming forgetful, easily confused, or acting in a way that is completely out of character. They might struggle to find the right words, forget familiar places, or become unusually agitated or withdrawn. These mental and behavioral changes can come on quickly, sometimes over a matter of hours or days. While it may be tempting to dismiss these symptoms as simple forgetfulness or part of normal aging, they could actually signal a serious medical issue. Medically, sudden confusion or personality changes may point to life-threatening conditions such as a stroke, transient ischemic attack, also known as a mini-stroke, brain infections like meningitis or encephalitis, or rapidly progressing forms of dementia such as Alzheimer's disease. Other causes could include severe dehydration, low blood sugar, or reactions to medications. Infections such as urinary tract infections, UTIs, or sepsis are also common culprits in older adults and can lead to acute confusion, especially when there is no fever or obvious physical symptom. A common misconception is that mental decline is just a part of getting older. Many people assume that forgetfulness or odd behavior is harmless or inevitable in seniors. This assumption can be dangerous, as it often leads families to overlook the need for urgent medical attention. Sudden cognitive changes are never normal, and they always deserve further evaluation. If ignored, these symptoms can lead to devastating consequences. A stroke left untreated can cause permanent brain damage or death. A brain infection or sepsis can progress quickly and become fatal within hours. Even a temporary lack of mental clarity could be a warning sign of an upcoming major health event. Every moment matters when the brain is affected. If you notice that you or someone close to you is experiencing rapid memory loss, confusion, changes in speech, or unusual behavior, seek medical attention immediately. Go to the emergency room or contact your healthcare provider without delay. A quick diagnosis can make the difference between recovery and long-term damage. Do not assume it is just aging. Act fast and insist on a thorough neurological and physical evaluation. The brain is incredibly sensitive and time is critical in protecting its function. 6. Severe and persistent abdominal pain. Picture this. You are going about your day when suddenly a deep, sharp pain strikes your abdomen. It does not feel like typical indigestion or a mild stomachache. The pain is intense, unrelenting, and may even radiate to your lower back or side. It may come in waves or feel like a constant ache. You might also notice your stomach feels swollen, tender to the touch, or unusually firm. If this pain lingers for hours or gets worse over time, it is not something to ignore. It could be a sign of a serious internal problem. From a medical perspective, persistent and severe abdominal pain can be a symptom of several life-threatening conditions. One of the most critical is a ruptured abdominal aortic aneurysm, where a weakened section of the body's main artery bursts, causing internal bleeding. Other potential causes include intestinal blockages, ischemia, lack of blood flow to the intestines, acute pancreatitis, or a gallbladder attack caused by inflammation or gallstones. These conditions can escalate quickly and often require emergency surgery to prevent death. Unfortunately, many older adults dismiss abdominal discomfort as something minor, perhaps gas, bloating, or constipation. They may believe it is related to something they ate or simply assume it is a normal part of aging. This mindset leads to dangerous delays in getting medical help. While mild digestive issues are common, persistent and severe pain is not, and it should never be taken lightly. If not treated promptly, these conditions can become fatal. A ruptured aneurysm, for example, can cause rapid internal bleeding and death within minutes. Pancreatitis can lead to organ failure, and a blocked intestine can result in tissue death, infection, and sepsis. The consequences of waiting too long can be irreversible. If you or someone you know experiences sudden, intense, or unexplained abdominal pain, especially if it is accompanied by vomiting, fever, dizziness, or changes in bowel habits, seek medical attention immediately. Do not try to manage the pain at home or wait to see if it passes. Visit an emergency room or call for help. Prompt evaluation, imaging, and diagnosis are essential. In many cases, early treatment can mean the difference between life and death. Conclusion: listen to your body before it's too late. By now, you have learned about 6 critical symptoms that no one over the age of 60 should ever ignore. These include unexplained extreme fatigue, sudden and severe chest pain, difficulty breathing, drastic weight loss, confusion or sudden personality changes, and persistent abdominal pain. Each of these symptoms may seem manageable or even harmless at first, but they often signal life-threatening conditions that require immediate medical attention. The key message here is simple but powerful. Do not dismiss changes in your body as just aging. While getting older does bring some natural shifts in how we feel and function, sudden or unexplained symptoms are never normal. Your body is constantly sending signals, and it's up to you to recognize when those signals are a call for help. Ignoring or delaying treatment can lead to devastating consequences: permanent disability, loss of independence, or even death. But the good news is that early detection and fast action can save lives, preserve your health, and give you a better quality of life in your later years. If you or someone you love is experiencing any of the symptoms discussed in this video, do not wait. Schedule a checkup, visit your doctor, or go to the emergency room. It's always better to be cautious and find out it's nothing than to wait and discover it was something serious. We hope this information empowers you to take your health seriously and be proactive in caring for yourself and those around you. If you found this video helpful, please share it with friends or family members who may need to hear this. Comment below with your thoughts or experiences, and don't forget to subscribe to our channel for more essential health tips and life-saving information. Stay aware, stay informed, stay healthy. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.